थिंक ऑफ दॅट रेमेडीज. इज फॉस्फरिक टाईप ऑफ, आपणच जर या 4-5 लोकांना यातनं उभा केलं तर प्रत्येक गोष्टी आपल्याला कळायला लागतील की हिज कॉन्स्टिट्यूशन इज डिफरंट, हिज कॉन्स्टिट्यूशन हिज लाईकवाईज. सो फिजिकल मेकअप इज ऑल्सो ए चेंजिंग. काही लोक असं म्हणतात की कॉन्स्टिट्यूशन विल नॉट चेंज. रॉंग. कॉन्स्टिट्यूशन विल चेंज. कॉन्स्टिट्यूशन विल चेंज, आय एम टेलिंग यू. So this is one thing. Boger's approach offers a new insight into the dynamics of the disease and its cure. Homeopathy can reach a wider view with the correct appreciation and application of the Boger's concept. The evolution of the philosophy in homeopathic prescribing reflects the profession's continuous effort to remain true to its principles while adapting the clinical demands. While Hahnemann laid the philosophical foundation and Kent refined its intellectual depth, Boger provided the much needed clinical balance. Boger's philosophy teaches that homeopathy is not merely an symptom correction, but a science of intelligent generalization. So that generalization in the sense what की मी जसं म्हटलं की सिनॉप्टिक की त्यांना पब्लिश करण्याची गरज वाटायचंच काय, कारण ऑलरेडी BBC आर. So if you go, say for example, Aeschylus, take the example of Aeschylus. Is remedy for what? Remedies? Piles. Okay. Oh, piles is what? Is dilatation and congestion of the rectal veins. So if there is this remedy, Aeschylus remedy is indicated for dilatations of the venous congestion. Why not for varicose veins all over other things? That is what is called generalization. That is how he explained in the synoptic key ki pathogenesis varicosity. That's all. Pathogenesis varicosity. His emphasis on time modalities, causation and pathological generals enables the physician to arrive at the simillimum even in complex cases. In the present era where diseases are advanced and time is limited, Boger's approach stands out as practical, precise and reliable. It bridges the gap between the classical philosophy and modern clinical practice. Actually, sometimes it is happening and many people they are advertising like that ki I am a classical homeopathic practitioner, and I don't know what is classical and unclassical. क्लासिकल आणि अनक्लासिकल एवढंच आपण डिफरन्शिएट करू की बाबा जे पीपल हु आर प्रिस्क्राइबिंग पेटंट और ऑल दिस इज अनक्लासिकल. Otherwise, if you are prescribing either on the basis of modalities or the basis of particulars also, particulars काढणं सुद्धा डिफरंटच आहे, डिफिकल्टच आहे. मोडॅलिटीज काढणं खूप डिफिकल्ट आहे. मी तर म्हणेन ज्या ज्यावेळी तुम्ही क्लिनिकमध्ये बसताय त्यावेळी तुम्ही असं काहीतरी फिक्स करून बसायचं की आज नाही, आज जे पेशंट मी बघणार आहे ते प्रत्येकाला मी मोडॅलिटीज विचारणार. आपण वाचतो ते मट्रॅमेडिकामध्ये फर्स्ट मोशन ॲग्रेवेशन, कंटिन्युअस मोशन ॲम्युलरेशन लाईकवाईज, बट रियालिटीमध्ये काय असतं ते. ओके. Thank you.
Anybody want to ask a question, sir? It's take an opportunity to ask a question. If you have any doubts or questions?
Any question? Yeah.
Master here to answer your question. So take a chance and ask your doubts, sir.
Sir, the question की patient जेव्हा विचारतो की थंडीनं पण आणि गरमीनं पण दोन्हीनं पण त्रास होतो, तर थर्मली तो पेशंट कशामध्ये कन्सिडर करायचा?
हा एक प्रॉब्लेम झालाय अलीकडं. थर्मल स्टेट इलिसिएट करणं ह्यात सुद्धा तुम्ही मास्टर पाहिजे की जे तुम्हाला इफ यू आर रिअली मास्टरिंग अँड यू नो दॅट पेशंट इज चिली, तुमचं मट्रॅमेडिका 50% बाजूला जाणार आहे. फक्त चिली रेमेडीवर आपण थांबणार आहे. पण हे कधी when you are confirmed. आणि ह्याच्या बाबतीत मी एकच सांगेन पुन्हा एकदा की कन्सिडर ओनली 2 थिंग्स, चिली हॉट. समजलं नाही ॲम्बिथर्मल म्हणा, सोडून द्या. समजलं नाही ॲम्बिथर्मल म्हणा, सोडून द्या. काहीही उगाच खेळ करत बसू नका. टुवर्स चिली, टुवर्स हॉट, मग ते कधी जाऊन पोचणार आहे हॉटला आणि कधी जाऊन पोचणार आहे चिलीला मला माहित नाही. पीपल आर रायटिंग लाईक दिस, टुवर्स चिली, टुवर्स हॉट. व्हॉट इज दिस? चिली आहे, चिली रेमेडीवर कॉन्सन्ट्रेट करा. भले अदर सिम्टमॅटॉलॉजी इज मॅचिंग, यू थिंक ऑफ चिली काउंटर पार्ट. So that criteria for the thermal modalities or thermal state understanding, fanning, bathing, covering and repeatedly, आपण समोर बसलोय ना, ती चिली आहे की हॉट आहे आपल्याला लक्षात आलं पाहिजे. अदरवाईज समजत नाही ना, ॲम्बिथर्मल म्हणा, सोडून द्या, त्याच्याकडे बघू नका. ओके.
बऱ्याच वेळा केस टेकिंग वेळी मॉडॅलिटीज पेशंट सांगत इतर सांगत किंवा त्यांनी स्वतः ऑब्झर्व
आहे की, बरोबर आहे की. मग पेशंट मेंटल पण सांगतच नाही हो. बरं, जर सांगितलं एखादा मेंटल तर ते रिलायबल असेल याची काय खात्री? याची काय खात्री की ते रिलायबल आहे? तुम्ही सांगाच म्हटल्यानंतर काय तर सांगितलं पेशंटना. ओके. नाउ ऍक्च्युअली व्हॉट हॅपन्ड even at the time of proving, when different remedies were proved, कशामुळं झालं किंवा what aggravates that is noted by the prover also. बघा, हे कशी गंमत झाली आपल्या बाबतीत की एखादं समजा बेलेडोना आहे आणि बेलेडोनाची हेडेक आहे, ते हेडेक कशानं जास्त होतं हे सांगितलं गेलेलं आहे, पण कशानं कमी होतं हे सांगितलं गेलं नाही. ह्याचं कारण काय की द थिंग इज ॲम्युलेटिंग फॅक्टर्स आर नॉट ऑल ॲम्युलेटिंग फॅक्टर्स आर ऑब्झर्व. म्हणजे असं होतच नाही ना की बाबा डोकं दुखा लागलंय, हां चला जरा वाऱ्यात फिरून येऊया, बघूया कमी येते काय, नाही आलं कमी. एकटं बसून बघूया कमी येते काय, नाही आलं कमी. थोडंसं काहीतरी हॉट घेऊन बघूया, कमी आलं काय, नाही आलं कमी. थोडंसं डान्सिंग करून बघूया, डान्सिंग ॲम्युलेशन आहे काय, नाही आलं. असं होत नाही. दॅट इज वाय ॲम्युलेटिंग फॅक्टर्स मोस्ट ऑफ द टाइम पेशंट काय करतो, आयदर मग पॅरासिटामॉल घेतो आणि तो कमी होतोय म्हणतोय. हे सगळं जे आहे हे आपल्याला लक्षात असलंच पाहिजे की प्रूव्हिंगचे हे प्रॉब्लेम आहेत. ॲग्रेवेटिंग फॅक्टर्स आपल्याला बरेच मिळतील, पण ॲम्युलेटिंग फॅक्टर्स कमी मिळणार आहेत. एखादा सांगेल पण काय नाही, जरा गच्च बांधून राहिलं की मला बरं वाटते, टाईट बँडेज और सम प्रेशर ॲम्युलेशन. नाही मिळत हा जो काही विषय आहे की नाही, मी तर त्यासाठी अजून पण इतक्या वर्षाच्या प्रॅक्टिस नंतर मी सांगेन, नाही मिळत ना, लिव्ह इट. जे कॉन्क्रीटली मिळते, मग मे बी 1 फिजिकल, 1 मेंटल, 1 पर्टिक्युलर, 3 स्टूल्स जे काय म्हणतो आपण, तेवढंच समजलं तरी बस आहे. 25 सिम्पटम घेतले आणि त्यातलं एक पण रिलायबल नाही आहे, काही उपयोग नाही आहे. अजून म्हणजे सिंपल गोष्ट, इवन थर्स्ट सुद्धा आय एम टेलिंग यू, मेनी पीपल्स आर नॉट नोईंग how to elicit the thirst, how to elicit the appetite. लिहितात हाफ लिटर वॉटरला काहीच अर्थ नाही आहे. कुठल्याही रेमेडीच्या कुठल्याही रेमेडीच्या अंडर असं लिहिलेलं नाही की थर्स्ट फॉर हाफ लिटर वॉटर किंवा लिटर वॉटर. तुम्हाला ते कन्वर्ट करताच आलं पाहिजे, आयदर स्मॉल क्वांटिटी किंवा लार्ज क्वांटिटी. आणि ते लार्ज क्वांटिटी आणि स्मॉल क्वांटिटी आपणच ठरवावं लागणार आहे. त्याला काही मेजरमेंट दिलेलं नाहीत की बाबा 30, 60, 90 असं काही नाही. स्मॉल क्वांटिटी आपण ठरवायची. म्हणजे ग्लास जरी आपण काउंट करण्यासाठी वापरणार असेल तर तो कुठला ग्लास, खेळण्यातला ग्लास काय तो पंजाबच्या धाब्यावरला ग्लास, एवढा मोठा ग्लास असतो, लस्सीचा ग्लास, पंजाबी लस्सी. सो स्मॉल क्वांटिटी कशाला म्हणायचं आणि लार्ज क्वांटिटी ही आपण ठरवावं लागेल. कमीत कमी आपण एक क्लासमध्ये असाल तर एक क्लासनं ठरवायचं की बाबा एवढं स्मॉल क्वांटिटी, एवढं लार्ज क्वांटिटी काय असेल ते. ओके, आय थिंक any I am always available, so thank you for giving the opportunity, especially Rajkumar sir, Santosh sir, Mukadam sir is from college day he is shining and till today he is shining on this. Thank you sir.
Thank you very much, sir. This is HOMESA School of Homeopathy, and that is the thing. The greatness of our school is that you can see my topic, thermal modalities. I am taking a very short lecture because बाप के बाद में बेटा क्या बोलेगा. But he's my teacher, and why I am standing over here is because of my teachers. So this is HOMESA School of Homeopathy. Even we had not planned, but the things are getting matching. This is our thought process. This is how we are trained, we are learn, and we are adopting the methods. Now here, thermal modality and their physiological basis. Many times we are aware that the homeopathy, we are going to ask the questions. But does there is any scientific significance for that? No, rightly, Vaishnavi had raised the question of thermal modalities. Thermal modalities are important. Everybody knows that why they are important. What is the logic behind thermal modality? How Hahnemann and Dr. Boger, they were so intellectual, how they pinpointed even the era before the science, the thermal modalities, and what actually we are assessing in the thermal modalities. That is our short topic for today's lecture. And thank you very much once again, sir, for creating a nice background. Now I hope you people understand the importance of this thermal modalities. So definition of thermal modality: hot or chilly patient, tendency to reflect internal physiological regulations. Are you agree with me? Yes. Expression of metabolic rate, autonomic balance, vascular reactivity, neuroendocrine and immunological status. Dear friends, you are not asking, do you need a covering, do you need a hot bath or cold bath? You are actually assessing all the systems. Is it simple tool to see inside the patient? Why thermal modalities are so important? What actually you are assessing? You are assessing metabolic rate, autonomic balance, vascular reactivity, endocrinological and immunological status. Tell me any investigation, one investigation that can give this much details other than thermal modality. Is there any MRI or any CT scan can give this much depth in understanding? Had you ever seen any examination like that? Now for this, you must know that what is core temperature and what is superficial temperature. The core temperature is 36.5 to 37.5 brain, thorax, abdomen. Superficial temperature, skin and extremities. Now superficial is very variable temperature. Core regulated by hypothalamus, superficial controlled by vasoconstriction, vasodilatation mechanism. Mismatch lead to thermal discomfort. I will tell you a story of one senior physician who was suffering, but nobody was able to elicit the suffering. And then he went to one hospital where my great friend, great clinician, he observed him and he asked him, "Sir, you are a senior and I am fully aware, can I allow to take your rectal temperature?" The senior physician said, "Yes, you are," and that was 4 degrees higher to the superficial temperature, and he was actually having fever, but because of old age, superficial skin temperature was not raising, and nobody was able to reach to the diagnosis. Are you getting point? Yes. So when we were student, we are taught that how to take up the core temperature by esophageal thermometer or esophageal. It's only experimental temperature, and rectal invasion of privacy. I cannot ask any question, any person to take, can I take your rectal temperature? Can I take your rectal temperature? Because it is the invasion of privacy, not so easy or simple. Because he was a physician, he was aware that this is essentially allowed, but not in every case possible. So what simple trick we had adopted? Because many patients come to you that I am feeling feverish. I am feeling feverish, I am feeling heat, but you take the auxiliary temperature, even oral temperature, your temperature is normal, and the patient is feeling feverish, and you have doubt that his, especially at old age, this mismatch is common old age. So what we are using in our clinic is that tympanic membrane test thermometer. Do you aware that the most perfect thermometer temperature, taking thermometer, mercury temperature, digital thermometer, we are having the technology to take tympanic membrane thermometer. Now, why tympanic membrane? Anybody can answer? Anatomy question. Why tympanic membrane? Because the blood supply to the hypothalamus and tympanic membranes are one and same. So, by measuring the tympanic membrane temperature, you are taking actually the temperature of hypothalamus, core temperature, and you can easily understand why patient is complaining internal heat. Patient is complaining of internal heat. Unfortunately, my thermometer had dropped down and still not working nowadays since last almost 1 year, but I am going to purchase it again once again. It's only 35,000 rupees, but it gives accurate temperature. So, core temperature taking is nowadays possible even in a comfortable way. So, remember, anatomy and physiology has a relation with homeopathy. Here I want to bring your attention the greatness of Hahnemann and Boger and all over Stallworth. As sir rightly explained, they are much ahead of a time. So here the temperature actually telling the hot patient, it means that something is wrong with the mismatch in core and superficial temperature. The thermoregulation mechanism, I hope you people are aware. Hypothalamus is called the thermostat, preoptic areas. The thermoreceptors are there in the skin and core. Effector sweating and shivering. Now autonomic nervous system mediate all this. Now somebody is complaining of excessively chilly or excessively hot. This means he might be a case of autonomic neuropathy. Autonomic neuropathy. Now here you can understand why lycosis is going. It's an autonomic symptom, palpitation, autonomic disturbances. Why arsenic, hot filling, lycosis, hot flashes, sulfur burning. What are these? These are all the neuropathies. Autonomic neuropathies. And now you can understand the greatness of homeopathy, as in modern medicine there are very limitations to give the relief this symptom, especially menopausal syndrome, basal metabolic rate and thyroid function. Again, you are not asking thermal modality, you are actually assessing the thyroid function test. Can you ask the question to take every weekly thyroid function blood test? No, it's cost affair. The cost matter, but by asking 3-4 simple questions, what actually you are assessing the thyroid function? Are you agree with me?
Yes, sir.
The thyroid hormone increases mitochondrial activity. Hyperthyroidism, heat intolerance. You called it the hot patient. Now look at the remedies you are using for the hypothyroid. Iodum, arsenicum iode, calcarea iode, lycosis, kali iode. Why iode? Why hot remedies? Sulfur. Why hot remedies are more matching? Because these modalities, thermal modalities are actually the logical thyroid function test. Hypothyroidism, cold intolerance. Which remedy you are giving to hypothyroidism? Calcarea carb, sepia, all the chili remedies are coming. So here, actually by asking the thermal modalities, you are assessing the thyroid function test. BMR is influenced by age, muscle mass and nutrition. Now again, if the patient is a chili, he may be having nutritional deficit. So what actually by asking the thermal modalities? Nutrition. Why nutritional deficit? Because of some malabsorption syndrome, because of some maldigestion, because of some worm infestation, because of the IBS, because of anorexia nervosa, some reason, anxiety, irritable bowel syndrome, somewhere you are actually asking hot and chilly patient, means you are actually in the nutritional status, muscle mass and age. Now why age matter, I am going to explain you later. Mitochondrial uncoupling protein, your UCP1, located in an inner mitochondrial membrane, create protein leak, heat instead of ATP. Now you know that mitochondria produces ATP. But dear friends, mitochondria sometimes do not produce ATP, instead it produces heat only. And this mechanism is a non-shivering thermogenesis. I hope you people are aware of shivering thermogenesis. The patient got chills. In a fever, patient got chills. Why chills? To raise the body temperature. But other way, non-shivering chills, non-shivering thermogenesis. This is done by mitochondria. Now, function of mitochondria, what we had taught is production of ATP. But dear friends, in certain situations, it does not produce ATP, it produces thermogenesis, upregulated by thyroid hormone and catecholamine. What is catecholamine? Mediators of inflammation. So, whenever there is inflammation, there is a fever. And why fever without chills? Now, in homeopathic rubrics, chills. Fever without chills. Now, there is a getting fever, but no chills. What is happening? Why fever comes? Because of muscular activity. By chills, there are actually increasing temperature by chills by muscular activity. But in homeopathy, there are so many rubrics, so many remedies where there is a fever but no chills, that is mediated by catecholamine by increasing UCP1, by UCP1, catecholamine, non-shivering thermogenesis by mitochondria. Are you getting the point? Now someday somebody comes, Gelsemium, getting chills in the back. What it is? Chills in the back. Why? Patient Gelsemium patient feels chills in the back. When there is a thermogenesis, there is a risk of injury to the spinal cord. Spinal cord. To protect the spinal cord, the chilliness or chills begin in the back. First, these muscles shake up, chills, they start generating chills, and then they get fixed. By fixing, we are actually protecting our disc. So, chilliness in the back. The remedies are like Gelsemium. Why? To prevent injury to the spine. Now you can understand how the provers were great. Rich in mitochondria and UCP1, that is a brown adipose tissue, brown fat, brown adipose tissue, activated by sympathetic stimulation, major site for non-shivering thermogenesis, reducing elderly and malnutrition. That's why old patients do not get temperature. Somebody is 80 and above, and if you got 100 fever, consider it 104. If your grandfather have 100 fever 100 degrees centigrade, it's not 100, it's 104. But why he is getting only 100? Because no bat, brown adipose tissue. So generally when you are looking the fever, you can see that a baby got very high fever. Even I had treated the patient with 107 degree temperature. Or Kothari sir's son. He brought to me and tell that he is getting a temperature 107. So give paracetamol 107. He said, why you are MD? What you are doing in MD? That time I was studying under your guidance, and he said, you have to do that. Why you are asking me? If there is a case of giving a paracetamol, I can give that. Now you have to do that, and I work on that. The simple technique I use in a fever, I hope I had told you previously. I use just simply put on pulse oximeter, note down the pulse, put on the dose, and look for the pulse. The dose is remedy is right, the pulse rate reduces. If pulse rate is not reducing, your remedy is wrong. Autonomic nervous system, sympathetic dominance, cold extremities. Some people whose sympathetic dominance, autonomic nervous system, are more sympathetic, they are usually having cold extremities, sweating. Parasympathetic means fatigue, cold tendency. Dysautonomia causes thermal instability. That's why in homeopathy, we don't ask the only thermal modality, we ask change in thermal modality. Are you hot today, but are you previously chilly and suddenly become hot, then it become characteristic. Are you chilly? Are you hot previously? Suddenly you had become chilly. Now the change in thermal modality, not only thermal modality, but change in thermal modality, because that shows autonomic dysregulation or autonomic instability. Anxiety and HP axis. Now mind. Stress, what is CRH? CRH reduces corticotropin releasing hormone, causing ACTH, cortisol, acute stress, vasoconstriction, cold hand. Now this thermal modality, cold hand, acute stress, I think many remedies are there for the cold hands. Acute stress because of cortisol, it is because of cortisol. Chronic stress, thyroid suppress, cortisol suppress thyroid hormone, that causes alternating hot and chilly state. Now alternate, sometimes chilly, sometimes hot, many types of thyroiditis. Thyroid function suppressed by cortisol, thyroiditis. So alternate hot and chilly state, it's a case of thyroiditis. Then there are so many Hashimoto thyroiditis, because white patch, vitiligo with thyroid, Hashimoto thyroiditis. TPO antibody and ATG antibody, anti-thyroglobulin antibody, easily available in market. But if you got this kind of symptom, understand it's a case of thyroiditis. Neuroimmune modulation, cytokinin, IL-1, interleukin 6. I think IL-6 was very common in case of corona. IL-6, cytokinin storm. You people are aware about IL-6. Affect hypothalamus. Prostaglandin E2 reset temperature. No, prostaglandin E2 reset temperature. Now many times giving paracetamol or antipyretic agent is doing more harm than good, because the body had reset its own thermoregulatory mechanism by actually giving paracetamol. What you are doing? You are reducing the threshold and you are allowing the virus to grow. Because that set change temperature causes less reduction of replication of virus. So antipyretic may do more harm than good. Fever is not a bad thing. Even fever chart, diurnal variation of fever chart in homeopathic modalities. You get so many symptoms about the fever chart. Morning heat, evening heat, night heat. Dear friends, in clinical medicine, fever chart is the diagnostic. There are patterns on graphical patterns without giving antipyretic. Without giving antibiotic, if you create the pattern, you can get the diagnostic, that is diagnostic task. So chronic inflammation altered thermal perception. Now the chronic cases, in a homeopathic point of view, chronic cases, Why altered thermal modalities? Now, altered thermal modalities indicate there is something chronic inflammation is going on. Nutrition and thermal regulation. Nutrition and thermal regulation. Muscle mass deficit. Fat provide insulation. Vitamin D deficiency. Nowadays, very common condition. Vitamin B12 and D deficiency causes fatigue and cold sensitivity. So many patients, so-called chilly patients, actually having deficiency of vitamin D. So somebody comes to you and he says he is feeling extremely chilly. That might be because of vitamin D deficiency, iron deficiency, reduced oxygen delivery. Again, the patient become more chilly. So while understanding the thermal modality, you can look for the anemia, looking for the pallor. So actually the thermal modality can be the marker of anemia, can be the marker of vitamin D. Now vitamin D, suppose you are doing a rural area, no vitamin D is available, or every time you cannot do. Trosus sign. Are you about Trosus sign? Aware about Trosus sign? Raise systolic pressure 20 degrees above systolic pressure. Raise BP cuff above 20 degree. Wait for 3 minutes. Patient gets spasm is a case of vitamin D deficiency, because vitamin D and B12 plays a role in neuropathy, and neuropathy is presented as a thermal modalities. Are you getting my point? Neuropathy and thermal perception. Small fiber damage altered heat and cold. So small fiber neuropathy is very common in diabetic patient. Small fiber neuropathy is altered heat cold sensation. Autonomic neuropathy impair vasomotor activity, common in diabetes and chronic stress. If you look, the prominent thermal modalities are given by the patient are usually of a patient of chronic stress. We can easily diagnose clinically a chronic stress. Ask the patient how many hair shedding per wash, provided the bath water should not be of your bore well. Your normal water, tap water, and the number of hair shedding per wash is directly proportional with your mental stress. So you can easily diagnose mental stress by asking simply how many hairs are shedding per wash. In the same way, by asking the thermal state, you can ask for chronic stress. Actually, you are taking the thermal modality, it's a mental history. It's a mental history. Change in thermal modality, it's a mind related to stress or diabetes. Drug effect on thermal state. Now patient is chronic patient taking different medicines. Now they can alter medicine itself, allopathic medicine itself alter the thermal state. So while considering the thermal modality, now this patient is very chilly, how can I give him sulfur? But what the allopathic drug going on, which is making him chilly? Had you ever think like that? So you are taking the history and many times they say, oh, he is a chilly patient, how you had prescribed the sulfur? He is really chilly or he is chilly because of allopathic medicine? So always remember one point, that drug can alter the thermal state. So always drug history is essential. In our clinic, we are giving up drug history, asking for every patient for the drug history. Without drug history, you cannot reach to the remedy. I will tell you one simple case. One case of a gout come, the four limbs, four joints, knee joints and ankle alternate changing, and he is getting absolutely resolving gout, and suddenly one fine morning he is getting up a gout, and his uric acid is 8.5. Now this is a calmia-latifolia, flying type of rheumatism. But dear friends, this was because of that diuretic antihypertensive. Antihypertensive diuretic was creating that all myths. So rather than giving them remedy, we had changed his antihypertensive and the patient was absolutely fine. So here, beta blockers, very common. What is the use of beta blocker? Antihypertensive. Beta blocker can alter your thermal sensation. Excessive thyroid hormone, patient is on already thyroxine, that can alter the heat tolerance. Steroid and SSRI, systemic serotonin reuptake inhibitors, psychiatric medicines, they can affect thermoregulation. So always asking the thermal modality, look for the drug history, what the drug patient is taking. Integration, modern physiology, mitochondria, heat production, bad thermogenesis, autonomic nervous system, heat distribution, HPA axis, stress adaptation. So these many, by asking the thermal modalities, actually you are looking for all these many. So integration with homeopathy, thermal modalities as a constitutional marker. But dear friends, they should be real, not the drug induced. Not to be drug induced. So always take the drug history. Expression of vital force reactivity, hot and chilly constitution reflect metabolic tone. So actually you are assessing the metabolic disorders. Metabolic tone, metabolic system. Integration with Ayurveda, Agni corresponds to the metabolic fire, Pitta, heat dominance, Kapha, cold tendencies, Vata, instability. Unified model of thermal modality, cellular mitochondrial efficiency, systemic thyroid basal metabolic rate, neuroendocrinal HPA axis, immune cytokinin influence, clinical expression hot and chilly patient. I hope you understand the importance of modality. By one simple modality, thermal modality, how much thing you are assessing? You are assessing neuro, endocrino, psycho, immuno. How many systems you are assessing actually? Conclusion, thermal modality is a multidimensional physiological marker. Reflects metabolism, stress adaptation, immune state, integrative understanding and enhanced clinical evaluation. Now, after giving, what happened after giving the remedy? After giving the remedy, if your thermal changes are corrected, goes back to their initial state, your remedy is right. So thermal modalities, many people ask only for the first time and they are missed in a follow-up. They are missed in a follow-up. In time of follow-up, you are not asking the thermal modalities. What is essential? Every time you should ask the thermal modalities, so that you can confirm that your remedy is right or wrong. So this is enough from my side. I hope you understand one small topic of thermal modality, it has greater dimensions. Okay. So I hope any questions? I had not enough bore you. Any questions? Thank for not asking question. I am not the authority to answer your questions like sir. But I am very thankful to sir that he had come and given some nice lecture. I am thankful especially to Chaugule sir and Sri, your name please? Yes sir, Dr. Lorge sir, they had attended our lecture and I hope, I had not made this lecture series compulsory for the student. This is optional only. This is optional. Those who are interested in reality in the science, they only welcome. Number is not matter. The quality matter than quantity. So once again, I'm thankful for attending on a Sunday. I hope you will get something more, something different from our side, and this will be our effort. Hopefully, it will continue for next few upcoming months. So we can continue the same activity. I'm thankful to Principal Sir and I'm thankful to Mukadam Sir. Every time he never missed the lecture. Since last two lecture he is there. So I request Sir to guide few words for the student. Up till Sir come because we have to take some photograph.
Already the book sir has given good guidance.
Critical review.
There is no critical. Already guidance has been given to you. Brilliant guidance has been given by our Khanaj sir and our energetic professor, young energetic professor. And the thing is that what information you gave today was really brilliant information. Even so many years of my practice, I never followed your Boger philosophy. So you are given us good information, and I think it's going to be more helpful for our this young generation also, as far as information is concerned. So this is definitely going to help you out for the young generation, those who are going to practice pure homeopathy. Okay? Thank you one and all.
I like it. 2 minutes. बोला students. असं एक 2 minutes sir. So, कोणी स्टुडंटला मनोगत मांडायचे का? Anybody want to come and speak 2 lines? Anybody? लाईट ऑन करूया. तुझं मनोगत व्यक्त कर. सरांचं लेक्चर कसं वाटलं काय आहे?
Good morning, sir. Firstly, on behalf of everyone, I would like to thank you. On behalf of everyone, I would like to thank you. It was an amazing lecture. Being a final year student, we always refer your textbook. We are referring for years, and it was an opportunity to meet you in person. So thank you so much, and it was an amazing lecture.
So yeah. Sir, उभे राहा. फोटो घ्यायचा. जिओ टॅग फोटो पाहिजे.